Hey guys, this is Dr. Clay Williams with Elite Enhancement of East Texas. I am a certified Urofil provider for penile girth enhancement. Unfortunately, like everything, the Urofil is a patented procedure. It's the only patented procedure worldwide. And with that, you're going to have other people who jump on the bandwagon and invent their own version of this procedure, and they don't understand penile anatomy. They're not board certified urologists, as we are the stewards of the penis, if you want to use that terminology, as we are professionals with andrology in male sexual medicine and reconstructive surgery. Board certified urologists should own the penis. I don't do facelifts. I don't do rhinoplasty, fixing the nose. I don't do rotator cuff repairs. So I stay in my lane. So other people should stay in their lane, including dermatologists and plastic surgeons, especially people who aren't even physicians, like estheticians, beauticians, sales reps. Yes, there's a company that was founded by non-physicians, and they unfortunately teach board-certified urologists who are, for some reason, persuaded to use their technique, and it has no patent, has no evidence, no research to it. And one of the things we're finding out is a lot of misinformation that some of you are bringing up on Frank Talk or Reddit, some other chat room, because you're seeing it on these providers' websites, and what they're saying is completely wrong, and it will misguide you. So a couple things. One, they try to say that using their cannula technique is better than using needles because, one, there's no bruising or swelling or bleeding with the cannula technique versus needles. Let me explain that something. Let me explain something. I don't care if you place needles in the penis or you use the cannula. Even though it says micro cannula, it's still very misfigured, and we see it all the time. When a patient comes in for me to fix a client who's had, unfortunately, the cannula technique done somewhere else, you can see the scars easy. It's so easy. And when they fill it with hyaluronic acid, the dermal filler, they look terrible. And without surgical removal in the operating room of that, they have these terrible looking cannula scars. But when you put a cannula, which is 10 times larger than a needle, if you're going to tell me that that doesn't cause bleeding, and that's what the websites say, no bleeding with cannula, I want you to think about that. If you put a needle, if you put a hole anywhere in the penile skin, you're going to have bleeding and bruising. So I want you to think about that. Number two, when you do the cannula technique here and here, you're spraying all this filler around here. Number one, that's too much filler at one time, and you can't control that hyaluronic acid, and it's going to move and migrate, which is another reason why Elite Enhancement, we fix those problems quite frequently. But with the needle, using the patented Urofil technique, we can control how much and where we place the filler. The interesting thing about the people who use the cannula technique is if you have a little area that's a little shallow here or wherever, and you want to add just a little bit more filler there, they're not going to go back in that cannula side and open that big scar and go back way back here. What are they going to do? They're going to take a needle with filler and they're going to inject that same area. So why not use that technique to begin with, since it is the patented technique, and the needle sticks are much smaller and the bruising and swelling much easier to overcome. The second thing we see that's misguided information is they will say that needles cause death of the tissue of the penis, specifically necrosis or death of the head of the penis, the glands, which is this area here. Now, they will show you pictures on their website of a dead looking or necrotic looking head of the penis and say this is due to penile girth enhancement using needles. No. What they did was they had girth enhancement of the head of the penis using dermal filler. If you place too much dermal filler here, whether it's needles or cannula, you're going to occlude the blood vessels, taking oxygenated blood to the head of the penis, and you'll occlude the veins, which bring blood back out, and you'll occlude the lymphatics. This is the reason why in Elite Enhancement, and you'll find with the Urofil providers, we don't condone and push for the head of the penis to undergo girth enhancement. But if you are hell-bent on it, yes, we will do it. But with a very, very, very small needle, using a very small amount of filler around the head of the penis here at the corona, and then 2 or 3 weeks later, maybe add a little bit more here, depending on how they're doing. But we do that so that the penis has time to form new blood vessels in and around that filler, so that you don't get that necrosis. But doing girth enhancement with needles around the shaft of the penis using the Urethral technique does not cause necrosis of the penis. So for any of you who are watching this and you've put that on your website, you should be ashamed, because you're misleading those clients and making them think that your technique using the cannula does not cause necrosis of the penis or potential, whereas needles can cause that. And you even put pictures on your website showing a necrotic penis, and you try to blame it on needles. It's not needles. It's placing too much filler in the head of the penis, and that's the issue. So any of you are coming across that on a website and someone puts that on the website, you need to run away from them, because they are purposefully misleading you and misguiding you. So I usually don't get very irate on these videos, but that's one area, talking about the cannulas are better than needles because it doesn't cause bleeding or bruising. Yes, it does, and it causes unsightly scars, and if they have to do any touch-ups, they're going to use needles also. The needles are a much better controlled way of doing the urethral procedure, the patented technique, filling up the hyaluronic acid for girth very slowly around the penis in a very controlled manner. And number 2, needles do not cause necrosis or death of penile tissue. It does if you inject too much in the head of the penis, which that only makes sense. But that has nothing to do with the urethral technique. So if you have any questions, please feel free to reach out. 903-732-2005, enhancedtexas.com. You can go to urethral.com if you have more information as well. I hope that answers any question and anxiety you may have.